Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about knee valgus or knock knee deformity. What exactly is it? What are some of the causes? And what can we do to help correct this deformity and improve your alignment with all functional movements? Before I jump into that, be sure to hit that subscribe button and turn on notifications if you're interested in catching regular videos related to knee replacement surgery, rehab recovery exercises, and everything else. So knock knee deformity or knee valgus is basically this movement of your knees toward the middle of the body, or we call it maybe a medialization. So you'll see this, for example, when you squat down or when you stand up from a chair or sit down in a chair. You may see this deformity when someone's walking, when you're going up and down stairs, any type of functional movement of the legs and the lower extremities, this knock knee deformity or knee valgus can present itself. And so there's three main reasons that I like to focus on for potential causes. Before I get into that, I will say that there's some individuals that have just a structural deformity, and even with any type of exercise or anything, it's not going to be able to correct it just because of the deformity or the poor alignment of their knee. And that's just like a structural deformity, and the only way to really correct that would be some sort of surgical intervention. But for a lot of people, it's more of a functional deformity, or something that you see with functional movements like walking, like squatting, or getting up from a chair. And with those individuals, those clients, I like to focus on three main potential reasons. There is a handful of different potential causes for it. It's kind of multifactorial, but I focus on three things mainly. The first one is just general mobility in your foot and your ankle. So if you don't have that good mobility to move your leg and bend your ankle, your body's going to look for compensations. And one of those compensations is it's going to start to have this pronation, or this flat foot aspect of your foot. And again, that medialization, that rotation of your hip and pelvis inward, all these different changes. That's more for another video, but there's a lot of things that if there's limitations at the ankle, your body's going to compensate all the way up your leg. So the other two things I focus on are, one is just what I call motor control, or what we call motor control. And that's just basically your body's ability to move and perform tasks in the way that you want to do that in successful ways. So for example, someone who comes in and they have this knee valgus, just having them do different movements that they can view, doing things in front of a mirror, sometimes recording them walking, can be really helpful. And then the other thing is the strength and stability in your hips and your pelvis. If you don't have good strength or adequate strength and stability in the hips, again, anytime you're going to move on one leg or anything like that, you can start to see this medialization. Your body doesn't have the stability, your muscles don't have the stability to keep the hips and the leg in a good alignment. So let's get into those last two aspects, the motor control and the strength. So for some people, what they'll use, some therapists, is they'll use a lateral step-down test to see if people have this knee valgus or this knock knee deformity functionally. And a lot of people with knee replacement surgery, that's a little bit difficult balancing and standing up there. So I'll just use a simple sit to stand, standing up from a chair. And what you can see, I'll say go ahead with your arms crossed or on your hips and just stand up from the chair. And a lot of times, if there's some weakness or just poor motor control, the person will stand up and they'll see either one of the knees, or usually both the knees, are going to cave in toward the middle, they're going to push up, and it's going to be something like that. Now, some of that may just be initial weakness after surgery and really just trying to compensate and get as much ability as you can to stand up from the chair. But some of it is just that motor control, just kind of knowing what it feels like to stand up with that good alignment of the feet, of the knees over the feet. And so what I like to use is a TheraBand loop. Really simple loop like this. Probably your physical therapist has one. probably some personal trainer or someplace in a gym, sporting goods store, get it online. You can even just get a regular TheraBand and tie it in a knot and make a circle. And I'll put it around both the legs. And I like to put it right above the knees. Anywhere below the knees basically works, but I like to put it right below the knees. And I say, okay, now your goal is to keep your knees in alignment with your feet the whole time as you're performing this sit to stand movement. So we don't want to let the knees cave inward. And so already with the band around your feet, around your legs, you have to activate those muscles and actively engage those muscles of your hips and your thigh to keep the legs and keep the knees in a good alignment position. So now as we stand up, we keep the knees and legs in good alignment, and then we come back down nice and controlled. If those muscles aren't engaged and we aren't doing a good job, then we'll see this, or it will just be really difficult to stand up from the chair. So I like to again use this as a good motor control technique, also a good way to start to engage and activate and strengthen all those muscles around the hip. And so I'll usually have a client do 5 to 10 repetitions depending on their strength, depending on how they're doing. And sometimes I'll do it in front of a mirror if I have that available, just to give that visual cue to see how the alignment of their legs is as well. And then usually what I'll do is after a little bit of a rest, have them take the TheraBand loop off, and then now keep those knees in that same good alignment and just stand right up again. And a lot of times you can see pretty immediate improvements. Just the fact that the person is more aware of their alignment, they're more aware of having those muscles engaged in the positioning, and you usually see much better alignment. And then of course the next step will be to carry that over to other functional movements, walking, going up and down steps, whatever that may be. So that's a real simple exercise, a real simple test and exercise that I like to use with my clients before and after surgery to look at if there is some of that knee valgus or that knock knee alignment with movements, and a simple exercise to help correct and hopefully improve that alignment as well. I hope you found this video insightful and helpful. Be sure to leave your comments and questions below, and I'll be sure to get back to you. Thank you.